right. I think we will call this May 2022 meeting of the Housing Community Development Commission meeting to order. So our first item number 2, we have 2 new members of the commission, Elizabeth and Carol. So I thought I'd just give the 2 of you a moment to introduce yourselves and what brings you to the commission. We'll start with Elizabeth.
Oh, yeah. Hi, I'm Elizabeth Merlicat. My pronouns are she, her. I'm a mobile crisis responder at Community. Hello. I think what brings me here is how often I see kind of the intersection between housing and mental health crises. And I do a lot of direct service, so it's just pulling me to think about systems change in addition to kind of supporting people when it becomes an emergency. Yeah.
And
And
Carol?
thanks for having me.
Hi, I'm Carol. Does this work?
It should. It can be a little tricky, though. I've never quite figured it out myself. About
You can
this
move
distance,
it closer to you
I
if you
think.
want.
Oh, yeah, it's working. My name is Carol Croats, and I am here on the commission because my interest also is in low-income housing. And from personal experience, I have seen this section of the population of citizens that don't meet the ability to pay fair market rent and fall way below, way below poverty lines. And sometimes it feels like we aren't welcome in Iowa City, that there isn't a solution. So I'm hoping at some point in my tenure, we can kind of discuss ways that the city might be able to help people with housing needs, because there are a lot of people that this affects.
Thank you, and welcome to the commission.
Thank you.
On this agenda item, there was one other thing I wanted to briefly address. There was an item in the packet called, I believe it's the Aorta Meeting Facilitation Guide, and I think the 2 of you should have received it as a part of your training. And if I remember the history here, we adopted this last year when Maria was the chair and I was the vice chair, I think. But the idea, and all of us should go back and take another look at it at some point, but the idea was to try to do what we can to bring out all the different voices of the members of the commission. I sometimes think about what is the strength of HCDC? What does it add to the city government that other types of or other facets of it do not? And we have a unique reach into lots of different communities in Iowa City, and we heard a little bit about that from Elizabeth and Carol, and it's also true of the rest of us. And if we create a space at the meeting where we can each bring our perspectives to it, we'll get a lot more out of it. So that's those guidelines are some things to help us do that. That's all on that I had on that item.
Is it open for discussion? Because
Sure.
I'd actually like to know, the one thing that I would like to see addressed is, how can we as commissioner get agenda items on the agenda? Because I think right now, the chair and the vice chair are setting the agenda, but I know earlier in the year, the bylaws were in our packet, and I asked about them, and I'd like to review them. And so I'd like that to be a future agenda item. But I'd like to know, and I think everybody would like to know, how do we get agenda items on future agendas?
Yeah, so I think the typical process is to say like a member of the commission who is not the chair would then start with the chair, right? Go to the chair, ask to put the item on the agenda, and then the chair would talk about it with Brianna.
Yeah, we meet quarterly with the chair and vice chair. So commissioners can bring items to the chair or vice chair, and they can bring it to us, and we can put it on the agenda.
Okay, does it have to be outside the meeting, or can it be inside this meeting where people can ask for future items to be addressed?
I don't know that I have a, do you have an
I
opinion?
know that
I
we
think
can't
it would need to be
discuss.
on the
I'm clear on that.
You could bring it up during the updates at the end, or discuss it outside of the meeting.
Okay, cool. That'd be great. Thank you.
item 10, staff updates. Yeah, okay. that seems like the natural place for it if we were going to put it on there. So yeah, that sounds good to me. Did anyone else have anything on this item? Right, number 3, consideration of meeting minutes. Did we have anything to note about the meeting minutes, or do we want to go straight to a motion for approval?
I'll move they're approved.
Second.
All right, so we have a motion and a second. All in favor, say aye.
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 Aye. Any opposed? All right. Number 4, public comment of items not on the agenda. Do we have any members of the public who would like to address us on an item that is not on the agenda? So if we don't have any public comments on this item, and this seemed like the natural place to address this, we had a discussion at our last meeting about how to handle public comments for items that are on the agenda. And after a discussion, we set out some criteria for what that would look like. But this would be the first time we're putting that into practice. So I wanted to very briefly tell you how I plan to address that. So let's see, I was looking at numbers, item numbers 5, 7, and 8 as being the ones where I would issue a request for public comment or a call for public comment. Those all seem like things that they might be something that someone would want to address. The other items on our agenda, I think, are either routine business items or internal commission discussions. So, for example, we wouldn't want to have public comment on welcoming new members. That's just a routine item, or the staff updates or adjournment, for example. Those are things we wouldn't have public comments on. But 5, 7, and 8 seem like things that might be of interest, where we would want to hear comments. My guess is that you'll probably want to keep refining this as you go. You'll probably learn as you go, but that's a start anyway. All right, so item 5, unsuccessful and delayed project updates. I believe we have 2 updates. You had items in your packet on this, but one from Neighborhood Centers of Johnson County and one from Shelter House. So I think what we have here are just presentations, right?
Yeah, we invited both agencies to attend to give an update on the project, so in whatever order you'd like.
Sure. Good. So let's start with Neighborhood Center of Johnson County.
Good evening. I'm Brian Loring, Neighborhood Centers of Johnson County. I'm the executive director. And just to give you a quick update, I think we conducted our the first project meeting with contractor back on May 4th, I think. And so that is for putting a new roof on our Broadway Center. And so I think the trajectory for completion of that's probably the end of the month, maybe the first week of June. So we've got everything's lined up for that. We have bids are open for the repavement of our parking lot at our Pheasant Ridge Center, and that closes on May 27th. So we expect probably to get at least a bid from that. Things have been a little bit challenging in terms of finding contractors, but I think we'll probably get a bid. And so hopefully that would be completed this summer. So I don't really have much more than that.
Yeah, do any
Questions?
commissioners have questions?
I guess my question would be, is there any concern from staff. I think staff, I read in the packet that staff were satisfied with the agency's response. But in terms of HUD, because I also noted a memo in the back of the packet from HUD to Jeff Fruin, so I'm a little confused about how long, and I've been there myself, how long, when a project is delayed, where the concern comes in for the money having to be repaid.
So for these projects, we haven't spent any money yet, so they wouldn't have to be repaid. The timeliness letter that we'll talk a little bit more about later is a checkpoint that HUD gives us, and it's really for all of our CDBG projects at once. So if several projects are behind, we're not going to meet our HUD checkpoint because we haven't spent enough money. For these both projects tonight, I know they're moving forward, and we're not concerned about them being able to complete it within the next couple months, I believe. So we're not recommending recapture of these projects tonight, but we did include that letter just so the commissioners could get an idea that when all the projects are behind and, for different reasons, not always at the fault of the agencies, that can get us in trouble with our HUD timeliness.
And what's the total dollar amount for the two projects?
The shelter house project was $225,000, and that both neighborhood centers totaled, I think, $37,000, a little bit more than that.
Okay.
And that's just the CDBG portion.
I read all of this, but sometimes I can't remember. Okay.
Else?
Yeah, do we have any other questions?
Thank you.
I have a business question of Brianna, which is that I know that if the commission decides to or recommends recapture, then of course we would have to take a vote. But if we don't recommend recapture, is there no vote required for this item?
Right, we're not taking any action. We'll just proceed with the projects as we normally would.
Okay.
And the reason, I guess I would also mention the reason I think we're bringing these forward tonight is because they haven't spent 50% of their project allocation by a certain time. So that's what triggers their presentation tonight.
The checkpoint was in March, so normally we would bring this to you in April, but since we didn't meet, it's a little bit later this year.
Sure. All right, we'll go to Shelter House.
Hi, everyone. I'm Chrissy Canganelli from Shelter House, and with me tonight is Trevor Conrad, who's principal with Modus. He's joining me today as he is the expert on the HVAC project and our lead, and we'll be able to do a much better job in talking about our status and our timeline and some of the challenges that we've faced. So this, again, is for the HVAC replacement project, and I'll turn it right over to Trevor.
All right. Yeah, as Chrissy said, my name is Trevor Conrad with Modus Engineers, mechanical engineer. We're doing the HVAC remodel for the existing shelter house. As you know, may or may not know, the construction industry has been difficult the past year and a half, staffing challenges and everything, but we're committed to getting this done. So my goal is by the end of the month, we have documents ready to go, bid in June, and then they can start that project. The project is a challenge because of some of the compromises and design decisions they made with the initial building 10 years ago. So, and a lot of the issues we're running into is just phasing, how you keep this building functional and occupiable for the tenants while this construction is going to happen. So those are just the problems and issues that we were running into. So I think we got a good handle, got that resolved. We just have to get it out there now. So, but like I said, shooting for the end of the month, have documents prepared, ready to go, and then they can bid the project in June. We've already had to do part of it. The water heaters in the building completely failed here a few weeks ago. So in emergency, we had to get that done, and I believe Chrissy used some.
Yeah, so we phased that project out separately and have used private dollars from the Housing Trust Fund of Johnson County to pay for that component. Like, we didn't have any hot water, so. and no way to get it back.
So you said the end of the month is when you're projecting bidding it out? Did I hear you right?
Getting the documents out for bid. End of the month, maybe into that first, I guess, 31st through the, I guess, what's the first full week, not the first full week, that first partial week of June. So in that time frame. So it'll be a couple weeks at this point.
And then once you get the bids back, how long of a project is it? I'm sorry if you said it, I'm having a little bit of trouble hearing everything.
No, I didn't say. It really depends on availability of things right now. Everything is
Yes.
unavailable. School work is about to get started, and the schools with different ESSER funds and other things, federal dollars, have sucked up a lot of material and equipment that's out there. So I would like it to be done towards the end of the year, but we just have to see. And we're in constant communication with different vendors and contractors to see what's going on, because we have to be. But everything is a challenge right now, trying to get materials.
So when you say end of the year, we're talking about the calendar year, December? Okay.
Yep. Yeah, it'll be, the equipment we've got, we're going to specify. Most of it is readily available, but there's like a component that it's hard to get right now, but we need it. So that's going to be the challenge. And those can have extremely long lead times. We're talking 32 weeks. So when normally it had been, prior to all the things that have happened, it would have been 8 to 12 weeks. So.
Sure. Okay, thanks.
Do we have any other questions?
Yeah, I can see a lot of construction now going on the shelter house. Is this project for the new building or for the old building?
It's for the existing building right beside. The new building is just getting completed.
So how is the construction now of the building? I know it's not related, but I'm concerned about that project.
On the new building?
Yes.
So we're looking at potentially having occupancy around June 10th, and we'll start moving people in right away after that.
Nice. Thank you.
Yeah, thank you.
So as a point of curiosity, are you planning to have to reduce the bed spaces?
Can you speak into the microphone? I can't hear.
Oh, I was just curious whether they were planning to have to reduce the bed spaces for any length of time to.
The overall building is not going to change. So, but there will be phasing. So components will have to be taken out. So there may not be heating and cooling for that particular area for a matter of hopefully days, maybe hours. But it's all in how stuff can be replaced.
Sure.
So overall, nothing will change, but there will be temporary inconveniences here and there as they have to shut and off things and replace them. So.
Bless you. I'd imagine, depending on the timing, if we can hit a sweet spot, we won't need heating and cooling for certain periods of time if we're like early fall, late fall. But otherwise, we do have the ability to go back into the winter shelter space, work with the county to be able to utilize that space to provide any additional beds if we do have to shut down any areas.
We should be available to avoid a lot of the heat of the summer at this point. We can get through a lot of that and into that late summer, early fall when it's starting to cool down again.
Yeah.
So.
I personally am not concerned that either of these projects are not going to be able to get the projects done and expend the monies that we've promised them. So yeah, I'm perfectly comfortable with it.
Oh, thank you. Personally, I have no interest at all in recapture. Did anyone else have any comments or discussion, or?
I mean, it might be good just to explain to the newest members that what is involved, because we did have a recapture last year, right? Wasn't that the church and the kitchen project? I mean, you guys might be better suited to just explain kind of what that whole recapture process is.
It might be worth saying exactly how many deadlines were involved here and sort of how far along we got before we went to recapture, maybe. That might be the...
Yeah, we've talked about it a little bit during training, but I would say that's usually like a last resort. Like I think with that specific project that was recaptured, there were several other checkpoints giving opportunities to Kyle's motioning for checkpoints to give opportunities to try to get things back on track. So it's really kind of a last resort situation to recapture the funds, because then, kind of to what Erica was saying earlier, the funds have to be put in another funding round and reallocated, and all of that takes time, which gets difficult with our spending guideline. So I would say that's an unusual circumstance, at least in my experience, to recapture funds. But I will say a lot of the construction problems that have been referenced are definitely a huge issue for our other projects and rehab. Just getting bids has been really hard due to COVID and everything else going on. So,
I mean, obviously we can all vote however we want, but usually we want to not recapture if we can at all
Right.
avoid it.
And they're not large projects, that makes it even harder to get stuff in. And then supply delays are tough too, so I don't have any concern about them.
I do want to slap myself on the hand here and be true to what I said in the last agenda item. I don't think we'll have any public comment on this agenda item, but I would like to call for it anyway. So do we have any public comment on this item? Right, hearing none, we have the option to have a motion to recapture or to move on to the next agenda item. All right, number 6, project monitoring updates. Here I believe we have 3 presentations. Let's see, we will start with all connected to the Aid to Agencies program, I should say. We'll start with Shelter House.
Hello again. Shelter House received $78,808 for FY22 through aid to agencies, $15,000 of which was resourced through CDBG funds. We dedicate these funds for emergency shelter, which has a budget of a little over $1 million. For the first 3 quarters of FY22, we have sheltered 593 unique, so unduplicated individuals. I did not calculate the to-date shelter nights, but in a typical year, we'll have about 25,000 shelter nights provided. 14% of the individuals served were children, 10% veterans. We had 51% self-reporting at least one or more disabling conditions. All operations are ongoing with emergency shelter. We're back at full capacity and have been for quite some time. Don't think there's really anything additionally to ask, to respond to or to provide other than, some recent very significant challenges for us. As we mentioned, we lost all hot water capacity for a number of weeks. Which doesn't make me feel any better, but there was no exaggeration in that CDBG application that we submitted for the HVAC system. It really is fatally, terminating. And staffing continues to be a real challenge. So specifically second and third shifts, finding people who are interested in doing the work, are willing to show up and follow through with doing the work. We've increased pay rates, benefits. We feel we're very competitive for those positions. Things are starting to get a little better, but been pretty heavy, especially as we're opening up another facility, and that has to be staffed 24/7 as well. So, but everything's in motion. Any questions that I can respond to?
Well, I think it's a double-edged sword for agencies. On one hand, I love seeing the pay rates go up and the better benefits, and it's my battle cry for years in nonprofits. But on the other hand, a lot of contracts, don't raise those rates, and so
Right.
I don't know. You can tell me in whatever way is easiest for you, whether it's what your base rate has increased over, from pre-COVID to now.
Yeah, pre-COVID was $11 an hour for the frontline evening overnight shift, and now we're at 15.
Okay. Well, congratulations on getting to 15. That's admirable. But that is a concern that I do have for many of the agencies having to, increasing their pay and their benefits to become more competitive, and where that money's going to come from. And I do think that, this commission needs to be verbal and proactive with the council in terms of the pot of money, the golden pot of money that we hand out to agencies, whether it's emerging agencies or the legacy agencies. So that's a huge concern that I have.
Yeah, in the short term, we've been able to resource that through additional COVID-related federal funds. But long term, that's additional fundraising. So
Yeah.
book sales, cakewalks. It's a curiosity to me that we are providing an essential service, a public service. There's widespread understanding that we prevent people, even through emergency shelter, from being in jail, from being emergency rooms,
Yes.
from facing death. But we are supported as a charity as opposed to other public services and facilities that are funded almost entirely, and this would include, frankly, GuideLink Center, through public funds.
Yes.
It
Yep.
doesn't add up. So.
I agree with you, and I think there should be a discussion about separating those activities out, and I'm concerned about how we're going to get to that. That when we get to legacy agency funding again next year, we're still going to be struggling with the same issues that we've had before in terms of the pot of money, and now we have new legacy agencies, which will be vying for money. So I just have a lot of concerns that we haven't really even decided how we can address some of these issues, and I want to get to that. So I didn't mean to take time away from you, but I think it's pertinent to what Shelter House, some of the increases and the things that you've struggled with is one of the many agencies that have been going through that.
Yeah.
Can I ask a related question? I don't know if this is for you or for the commission, but are these aid to agencies funds restricted to things like facilities, or can those funds go straight to staffing costs?
They're operational funds, so agencies, they're flexible. Agencies can use them how they see fit.
So, and these funds are entirely different from a separate competition through which we were awarded those funds for that HVAC
For the
repair.
HVAC.
Yeah.
Yeah.
Thank you.
Yeah. Any other questions?
Yeah, I would like to thank you for serving our community. What I hear, these are incredible numbers on that you say them, and thank you so much. I think the face of the city will be very ugly without the shelter house services. So what is the most challenges that facing you right now?
The most challenges?
Yes.
Continuing to grow our work and ensure that we have trained, competent and fairly compensated staff. They're passionate, but being able to retain those employees and ensure that we are maintaining a safe work environment and living environment for our clients, for our tenants, and then work environment for our staff. That weighs pretty heavily on us. We've got really good programming. We're recognized statewide as a leader. The work that we're doing, we're showing the impact in all of the areas that HUD requires us to, that our funders do, and that I feel that benefits our community. It's just the sustainability of the work and being able to grow it. Does that answer your question, Ezra?
Thank you.
Yeah. And high complex need people, just really increasing numbers within the population that we're serving of people who have systemic health issues, not just one disabling condition, but multiple substance abusing, polysubstance using individuals in combination with serious mental illness. And the challenges of working with those individuals in congregate environments, and then when we get them into housing. But the housing's working, so it's super exciting to see.
Is staffing this is maybe a longer conversation, but is staffing the biggest obstacle to running the low barriers year-round right now?
It's so all shelter is low barrier. Our entire organization is low barrier, and I think we haven't done a great job of being able to of really communicating that proactively. So there's really little to no difference between what is understood as the winter shelter and the 429 24/7 365 shelter. It's just additional capacity and tends to really focus more on folks that just don't want to come into the other shelter, and they don't want to be around families. So you see single adults in that winter shelter. That wasn't always the case. It used to be that there was a differential between. I think that low barrier has definitely increased the challenge for us and our need to make sure that we're preparing and supporting our staff in ways that they know how to work and engage with the individuals safely and supporting. So that's been learning for us. But even more so, what we're really finding out is that as we've made these changes internally, and we have committed to housing first and low barrier, other systems and other entities with which we intersect and with which our clients and tenants need to work, they haven't made those changes, and they haven't come closer to us. So they have barriers, they have limitations, they have ways of thinking and being that have stuck these individuals into boxes which prevent them from really being able to meet us and our folks where we are. That's the next real big work, I think, that we have ahead.
Thank you.
Yeah.
Thank you.
Thanks.
Thanks, Chrissy.
We'll go next to Domestic Violence Intervention Program.
Hey, thank you for having me. My name is Ashley Hopkins. I'm the development coordinator for DVIP. These funds go towards our shelter services and hotline. We just a little bit, if you guys aren't familiar, we provide emergency shelter 24/7, 365, and in our shelter we house our hotline. We provide housing assistance, safety planning, help with protective orders, and counseling for victims of abuse, human trafficking, and harassment. We do serve 8 counties. Our shelter is here in Iowa City, and the majority of the people that we help are in Iowa City. We also do educational pieces within the community on relationships and how to help a friend. Most of the people that seek our services hear about it through word of mouth, and many call our hotline first, so it's always important to us to get that number out there. And as I said, that person is in our shelter. It's a full-time position. In the last 6 months, we've had 601 hotline calls taken. And the hotline calls are a myriad of questions from victim survivors, friends, families, coworkers, about how they can get help. In our shelter itself, we've served 85 people, 49 women, 1 male, and 35 children in the last 6 months. And that's resulted in over 5,000 nights of safety, with the average stay being 40 days in the shelter.
Average stay, I'm sorry, is what?
40 days.
Okay.
So the funds have always gone towards our shelter services.
You mentioned that you service 8 counties, is that correct?
Yes.
But the majority of your clients are from Iowa City?
Yes.
Do you happen to have a rough estimate on what percentage of your clients are from Iowa City?
It is just about half from Iowa City. So in fiscal year 21, we served over 2,000 victim survivors in the 8 counties, and it was 1,100 in Iowa City, 1,500 in Johnson County.
Do you service Des Moines County?
Yes, we do. So we serve Iowa, Washington, Cedar, Henry, Des Moines, Van Buren, and Lee counties.
Thank you.
Yeah, of course.
Did we have any other questions?
Yeah, are you able to serve all the clients that seek your help?
Yes. So we do. So as far as sheltering, we do have to come up with different ways of supporting clients with emergency shelter because our shelter is full 365 days a year. So for us, that looks like finding hotel stays that are temporary, and then potentially working them into our shelter, or looking at permanent housing solutions or options. Since we serve 8 counties, it can mean also a bus ticket to family somewhere else. It's just connecting with resources in our communities and a lot of safety planning. But yeah, emergency shelter is our #1 request.
I'm going to ask a similar question that you asked of Shelter House, and what are some concerns that you have coming forward?
Sure. Yeah, this fiscal year, we are facing a 15 to 22% federal cut through our VOCA funding. Next fiscal year, there's been a VOCA fix enacted the funds will be reallocated into the VOCA fund by next fiscal year, so we'll be back at where we were. But that is going to be a challenge for us this year. So it means we've already been trying to diversify our funding for the last several years, many years, to have more individual donors and to get away from the state and federal funding. But we still are at about a 60-40 split on that. So that is a huge challenge for us.
How about staffing?
Yeah, we're having similar issues that Shelter House is having. I can't speak necessarily to the pay rate as I'm just the development coordinator. But yeah, we're having some turnover issues, and I think a lot of it is definitely burnout from COVID and just the extra stress that our advocates went through. Also, the tremendous effects of COVID on those that we serve. We saw a 25% increase in our hotline calls in the last couple of years because of COVID, and an increase in those that we serve. Just here in, I don't have Iowa City specific, but Johnson County, it was a 300% increase in those seeking our services.
In what services?
Any direct services, people reaching out for help.
How many hotline calls did you say you got in the last 6 months?
601.
Okay.
Yeah.
Do you have a core of volunteers who can assist when you are a little short on staff?
Yeah, so we do utilize volunteers. We are talking about potentially having, again, some more direct service volunteer options. During COVID, we were limiting the interaction in our shelter and with our clients to very minimal interaction with outside public. So volunteers were helping us sort donations and things like that. But our board of directors were just meeting about that at the last meeting a week ago. Potentially, it does take quite a bit of training to do direct service, and so trying to figure out ways to ask for a commitment of 2 years for a volunteer to do that. But it is something being talked about, certainly. Yeah.
Thank you.
Yeah. Thank you.
Thank you.
Thank you.
And next we have Neighborhood Centers of Johnson County.
I think Brian got away from us a little too quick, but I did their monitoring visit. I can't speak to the project in specific detail like they'd be able to, but when I did their monitoring recently, I know their funding is on track to be spent, and they're on track as well to meet their accomplishment target by the end of the fiscal year. So.
Well, then next we have number 7. So we're looking at the annual action plan for number 7. I believe here we have a staff presentation, a discussion, and a vote.
Yes, let me pull it up here. So I'll try to keep this short. Our action plan is basically a piece of our consolidated plan. This is what says what we're going to do for the next fiscal year. Our fiscal year starts July 1 and runs through June. This is the document that contains the recommendations that HCDC just made recently. It's a long document. I always give the preface that the format of this report is something that's required by HUD in the federal database, so we don't have a lot of flexibility in editing it or trying to make it more user-friendly. We've tried to make changes where we can and include extra tables that maybe make the information a little bit more clear, but we are a little bit stuck with that system, so we try to do our best with it. The most interesting part of this for you is probably the Appendix B. That's where your funding recommendations were at. I sent out a second draft of this recently, so thanks for your patience on that. HUD was a little bit late this year sending out our grant allocations, so we were able to put the final numbers together. The public comment for this plan starts tomorrow, and it will run through June 21st. So the next step after the public comment period will be the plan going to council for approval. We'll enter it into the federal database, and then we'll submit it to HUD for approval, and we'll wait for our grant agreements after that, assuming the plan is approved. So I can entertain any questions that you have or comments.
I mean, some of the things in the action plan are, of course, very promissory, which is just probably the way things have to be, because they're going to be decided later. But I did want to ask about, there was a section where the city owns certain properties that may be used for affordable housing. I think one was on Muscatine. The other that I know about was 724 Ronalds. Does the what the action plan says, that just means that the decision hasn't been made yet?
I'm not as familiar with our local.
Yeah, so it's a HUD question that they ask if there's any city property that's available for affordable housing, and we just list essentially what we own that could be developed, and those are two of the properties that the city's actually had for a little while. I know the Ronald's property, well, the Muscatine one I think is more suited for economic development, more of like a commercial property. Mm-hmm. The Ronald's one has a dilapidated structure on it that's going to be demolished.
It was demolished last week.
Was it?
Yeah.
Okay, so that happened.
I walk by it every day. That's part of why I asked.
I don't actually know the plans for that, if they're in place or not. We may be partnering with another agency for housing. I'm not certain about that.
Was there a final draft or a final presentation of the steering committee's affordable housing plan? The committee that got all put together, and
So-
was there like a final report of these are the steps we should take that they decided upon, or?
So the status of that is that there's a draft of the report and it has gone to council, but council hasn't discussed it yet. So I think a future work session will feature that topic, and the council will discuss it and maybe adopt the plan or make changes to it.
Okay.
I can send you the draft tomorrow when I send out follow-up for the meeting.
I just was curious if that
I'd
had
like to
gotten, yeah.
Yeah, I'd like to, I'm sorry. I'd like to see that too. And could you let us know when it's going to be on council agenda? So if we want to watch, we can.
Sure.
Yeah, I don't think you do, but,
I like to just download the information later, but yeah, I'm curious because I haven't seen that be a very visible public, like here's what they're getting. So I'd be curious to see it, because some of the part that of course I'm more interested in is like the section 12, I think AP 75, where they're talking about tools to remove barriers to affordable housing, such as building codes, fees, charges, growth limitations, policies affecting the return on residential investment. I'm curious if there's actually any action planned or proposed to address some of those things directly. And I just don't know if there has been, or I know land use has kind of gotten the spotlight. But I know, we've discussed it a little bit, and I've discussed it a lot outside of here, which is sometimes it seems the city acts against its own interests. It makes comments about increasing affordable housing and making rental properties more, more affordable, but then the turnaround of that is, $30,000 between properties last year for radon testing and radon mitigation for what ended up being only a 1% of all properties actually had any radon issues. Switching rental permits from every 2 years to every year for 4 units or less. So instead of properties having an expense of $300 every 2 years, now it's $300 every year. I mean, all of those things from a residential investment side gets passed on through higher rents. It's just, yeah. And I just haven't, I'd be curious to see what that committee came up with ideas to somehow counteract what seems to be us shooting ourselves in the foot a lot, which is making these claims that we want more affordable housing, but we haven't seen the security deposit program that's been talked about for years. We haven't seen the affordable housing. There was discussion at one time for affordable housing, like maintenance pool of money for damages from for HCV tenants or HCV properties. We just haven't seen that. So have you guys seen any action from that side of things, or?
We do have a security deposit program that's administered by Community.
Which helps, they do, yeah, and they help pay double deposits in some cases, and, right.
Is that what you were talking about?
Well, it's, the problem is it's not always available to everybody. I mean, I haven't seen an expansion of that. And part of the issue is it's not just deposits. I think Chrissy could talk on this somewhat. I mean, we have a lot of times where, shelter house can only pay like 2 months worth of rent, and that's just not enough for people to get back on their feet and get, and get an income started before HCV takes shape, or there's only so many emergency housing, but what's his name? Steve, when he came and spoke, and talked about, there's, there's a limited amount of vouchers and how many people sitting out there on the waiting list. I'm just curious if there's any intent to start putting some of these money into more direct rent relief programs at the local level, because at some point the Iowa Finance Authority thing is going to disappear. I mean, they're already making it harder and harder for tenants to get rent relief. I mean, it went from tenants being able to log in, present their issues, have landlord confirm amounts due, landlords getting payments within 2 to 3 weeks, to we've got tenants that are 90, 120 days out that we're trying to work with Iowa Finance Authority now that they just can't get approval from the state. Like it's a nightmare of bureaucracy. They switched over their online processing, online submittal stuff, and it's a nightmare. I'm just curious if there's been any discussion from the housing plan for more direct action stuff, but maybe it's in maybe it's in that draft. I just don't know.
That's what I was going to say. I don't know all the ins and outs of the plans yet, but I know it was just finalized in the last month. The draft plan just went to council very recently, so we can keep you apprised of those discussions.
I think if there's any public statement or update from the steering committee, I think that's something we want to hear about too.
Mm-hmm. Carol, were you going to say something?
So why, this could be a really dumb question, why doesn't it come to this commission before it goes to council?
The plan?
Yeah.
That's such a great question.
Is it a good question?
The committee had representation from HCDC. Peter from the commission was part of that group. So they didn't take it to, the plan incorporated a lot of different affordable housing issues. It was land use issues. It didn't go to P&Z. It was representatives from different commissions were on the committee. Council could bring different issues to HCDC. That's up to them to decide. They have not discussed the draft report yet.
Okay. Well, I think Kyle brought up some good points. I'm sorry, I think I saw that you maybe had something you wanted to say.
No, I'm sorry, no.
No, okay. I didn't want to cut in. So this annual plan is a kind of a one-year document that is of the bigger 5-year comprehensive plan. So a lot of it was pretty routine reading for me. But I'm going to go back to something I said before, that if we're going to make any real changes in the way in which we fund legacy agencies, and I do believe that the city should be contracting for some services, and some agencies can be treated a little bit differently because of the kinds of services that are provided. We have to have some real time to explore that kind of thing, and I just don't see that happening, and that's one of the concerns that I have. I don't want my 3 years to be spent here just coming to Thursday meetings and, hand stamping things. I want to make some positive changes to the way in which the legacy funding is allocated.
I will just make a quick note that the majority of this plan deals with our federal funding, so we just only have a slice of that we can use for public services, but we will be diving into the legacy agency stuff coming up.
Okay, good. Because I will note that somewhere, I can't lay my mind on it right now, but I know in Jeff Fruin's plan, I can't remember, was it 21 points for restructuring and things that there's still money in there for an agency needs assessment, or a community needs assessment is what it's called, that would give us a comprehensive look at the types of services that we do need in our community. And I think that I'd like to see HCDC involved with that in some way, whether it's a liaison type of role or something. So that's it. Off my soapbox.
I do have one question that really is a little off the mark here, but is it possible to get these graphs or these spreadsheets in bigger font? I can't read them.
Possibly. The hard part is trying to upload it into this system makes everything really tiny, but we do have much more user-friendly,
Maybe
normal-looking.
landscape view?
Yeah, we can do that.
Actually,
you.
the ones, the updated ones you sent me, they were bigger.
Okay.
Because before I was trying to use my phone magnifier on them, and it didn't work. I had the same problem. That's why I laughed.
I almost brought a magnifying glass, but I didn't want to be the odd person out.
The other problem
ahead
is
and
the
bring
city
it.
website. Sometimes when we update things, it changes the format when it's uploaded online versus me sending you a PDF. Sometimes the PDF is a little bit more user-friendly.
Okay. Yeah.
Any other questions or comments?
So do we, we need to pass this along as a recommendation, right?
Yep.
We can entertain a motion to do so if anyone wants to give one.
I will make the motion to recommend it to council.
And do we have a second?
Second.
All in favor, say aye.
Aye.
Aye. Any opposed, say aye. All right. Item number 8, review and consider recommendation to City Council on approval of substantial amendment to City Steps 2025, the city's consolidated plan. If I'm reading this correctly, and I think I read it correctly, this is just something that we did returning to us.
Yeah, this is just a formality really that starts the official amendment process. So you'll make the recommendation, it will go to council for final approval. You've already made your agency decisions and had those discussions.
Right. So I think especially for our 2 new members, we had a discussion as to whether and how to add agencies to the legacy agency list. We approved the adding of 3 agencies, and this would the correct way to put it be we are officially sending this along as a substantial amendment?
Yep, to our consolidated plan, which is called City Steps.
Okay, good. Hopefully that makes it clearer than it was before.
You already decided to do this,
Yes,
and we're just confirming that.
right. But we should ask for discussion if anyone has any discussion of this.
Ooh, should we have had public discussion on 7? We didn't, did we?
I forgot. A bad habit. I don't think we had any public discussion on 7, but if anyone did want to talk on 7, I apologize. My bad. I'll give you a free pass on number 8 if you want to talk about number 7.
Good catch.
But no, I mean that's good. I'm trying to develop the habit of asking
I just
for
thought
it.
of it too, so.
Yeah, it's like smoking. You have to just keep doing it, and eventually you just don't think about it. Do we have any discussion among commissioners for number 8? Do we have any public discussion on number 8 or number 7? All right, I would like to make a motion then to, how do I want to put this? Recommend to City Council the approval of the substantial amendment to City Steps 2025, the city's consolidated plan, the amendment listed. Would anyone like to second?
I'll second that.
A second from Elizabeth. All in favor, say aye.
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 Aye. Any opposed, say aye. And any abstentions?
Count me as an aye. I didn't say it, but count me as an aye.
That's why I asked for abstentions. I didn't hear you.
I'm going to go ahead and say aye.
If I remember, your objection was you wanted to add more than the
No,
three
my
agencies.
objection was that the way I read it is that it wasn't the right time to do it.
Okay.
I still think as per the wording that the 5-year plan said this is the 5-year plan and these are the ones that get to do it, and that these are all worthy groups, and I mean as a group we all agreed that that they belong in it, and I'm just gonna say aye, but yeah.
I don't disagree with what you're saying at all. And this is part of that larger discussion that I'm going to keep harping about, that also the calendar and when we do things and putting some formal processes into place is really what we need.
For that, as you, because eventually, whenever the 2024 budget is being done, I think is when this will come up. But when you get to the point where you're ready to ask the council for more legacy agency funding, get in touch. I'd be happy to help in whatever way I can. I won't be a commissioner at the time, but I might be able to go to council to speak.
Okay.
Number 9, Iowa City Council meeting updates. This is another thing that I might say a brief word about for our new commissioners. But about a year ago, we started doing assigning one commissioner to attend city council meetings or review city council meetings, and then give an update to the commission on relevant topics that came up during that meeting. So for the most recent one, I know I was one of the people who volunteered because I appeared about a month ago at a council meeting to accept the mayoral proclamation for National Community Development Week. In fact, I brought a show and tell. This is the mayoral proclamation for National Community Development Week, and I thought I'd pass it around to give you a chance to look at it. Of course, since Caleb's not here, I'm going to have you get up and go this way. And that concludes my update. I think Becky was the other person.
Yep. So I just saw really two things. I did the second meeting in April, and they finalized the Forest View relocation, which doesn't really have anything to do with HCDC, but I think it's noteworthy to highlight that in our meeting. And then, of course, the long-awaited vacancies in our commission, they voted on those also. I'm sorry, I know we didn't have a meeting last month and nobody was assigned for May, but I just couldn't, I didn't have time to do it, so I'm kind of in a busy period right now, so I didn't watch May's.
Oh, you've done absolutely more than your share of the
I know,
the updates.
I'm not going to volunteer this month for anyone.
Do we have anyone who would like to volunteer? I think you would be volunteering for the next meeting's in June, isn't it?
First and third.
Yeah. So the first and third Tuesday of June.
So pretty.
It's too close to my birthday. I'm not volunteering.
Probably.
All right, Elizabeth.
I'm just super busy, so.
So the person covers the whole month of both meetings that month?
That would be fine, or you can split them. I mean, either way.
They're online. You can
yeah.
live watch, or to
Yeah.
tell you the truth, you can get the same experience watching afterwards too. So you can just, usually it takes a day or two for the meetings to post after
The
live
city
watch.
has a YouTube channel where you can watch them anytime.
Yeah, there's 3 different ways you can watch them. I do a lot of that. I watch them when I have time, so.
And if anyone doesn't know, we also have a YouTube channel where you can watch our meetings.
How many views do you get on these meetings?
I don't know.
Just my mom.
I don't know that I've ever watched them.
HCDC has a channel on YouTube.
Well, I don't. It's the city's channel, right? But
Yeah.
our videos are on there.
We usually get like 30 views, but I suspect that half of those are just for the minute, so don't worry, we're not that popular.
You're on candid camera. Well, actually, it's not candid. The camera is right over there,
I'll
so.
check it out.
That's why I do my hair.
Okay, so Elizabeth is volunteer. I am going to, as we move on to the next agenda item, I'm going to write that down. I frequently forget at the next meeting who did it, so I'm going to try to remember this time. Item number 10, staff updates.
We weren't planning to have a meeting in June, but we have something coming up that we probably need the commission's feedback on. So we are looking at June 23rd, which would be the 4th Thursday. My plan is tomorrow to send you an attendance survey so we can kind of put a feeler out and see if we have a quorum for June. So I don't know, we can make that an abbreviated meeting if people are busy with summer plans, or kind of see how that goes.
Do we have full membership now?
We do. We had 3 more people appointed last night. Mary Ann Dennis was reappointed, Zachary Slocum, and Jennifer Haylett. So we'll be back up to 9.
Okay.
And that will switch over July 1st.
Right. I think that the 3 appointments from the last time are July 1st. So yeah, we should have 9 next month and 9 in July.
And then I guess there was a couple items in the packet. The first one I'll just mention, we tried to make a handout of just a quick guide that might help during meeting discussions. There's so many acronyms in anything with federal funding, so we tried to make a little quick guide for you. If you think of other things that might be helpful for new commissioners, definitely let us know. And then the other item in there was a timeliness letter that Erica was going to touch on.
All right, so we talked about this a little bit with one of the other agenda items, but for CDBG funds, we can only have 1.5 times our current allocation in our HUD account. So when we do a project, the city funds it, and then we draw from HUD, and they reimburse us. That's kind of how that works. Ideally, with CDBG, we get the money for the program year and we'd spend it all within 1 year. But as you've seen from our delayed projects, that doesn't always work out. That's not that easy to do. We have certain kind of procedures in place to spend the money within the year. Certain projects like our rehab program, if we don't spend our set aside within the year, it gets kind of lumped back into the pool for the next allocation. Certain categories you can only spend within the year, like the public services that are funded by CDBG, they have to be spent within the fiscal year, as well as admin, which is like our staff salary fund that we can use. But when we get several projects that are delayed, for whatever reason, it's pretty common to have delays right now, we get a little behind. So we got this letter this year that we were not on track to meet our timeliness. Every year it's on May 2nd, so we have to have less than 1.5 times our allocation in the account on May 2nd. So they're tracking that throughout the year. So we got this letter in April. We had to spend down $168,000, and I'm actually really excited to report that we did that, thanks to Brianna hounding people and getting their invoices in and getting their projects done.
Good.
In the
You
very
could've just
last,
called
I
me.
think. What's that?
Could have just called me. I mean,
Yeah,
you just
right.
needed a way to get rid of $160,000.
Yeah. So we were able to, I think, maybe on one of the very last days, process one of our parks projects, and that went through, so we got down below 1.5. The consequence for not meeting this, right now, because of COVID, they would just issue us a warning because we haven't hit it before. After that, we have to do a spending plan with HUD, which is really a lot of administrative work, and we want to avoid that if possible, so we're really excited that we didn't get the warning this year and be possibly in trouble for next year. And then the
You
third
guys
year.
love administrative work.
Yeah, it's, I haven't had to do it, and I don't want to learn how to do it, so. And then the third year, they can start, if you're not spending your money, they can start reducing your allocations, which we really don't want. So we just wanted to share this, that it's been with the CDBG CV funds, it's been challenging to continue to administer the programs and meet all the deadlines, but we just squeaked by this year. Brianna's doing a great job getting the projects moving forward. And the agencies are working to get their projects moving forward as well. Trying to think of what else. I think just another thing I want to say is that the closer to that 1.5 each year, the more difficult it is the next year to get below, because you're kind of getting more and more behind each year. And I feel like that's kind of on the path we're on. So we're going to work hard to get some of our bigger projects through next year. We have that DVIP as a big CDBG project, right? Shelter House will get their project done. Neighborhood centers will get their project done. So we'll just keep chipping away at the projects and try to get ahead.
I appreciate you going through that, because I think it helps me understand. I know about the late projects, and I know about there's a benchmark, and that's about the extent of my knowledge. But it helps me because it again behooves us as a commission to make sure that how we're funding money and what we're funding, and that we're paying attention to history of the recipient and their ability to carry out the project. And I think that's important information for us to have.
Is there a history of not meeting the one, what did you say?
The
How-
1.5.
Yeah. Is there a history of that, or do we usually do really well?
We have hit it every year since I've only been with the city for about 4 years. I think they've had to do a work back plan once a long time ago. They didn't issue a warning before. It was just if you missed it, you had to do the plan. But now there's kind of an extra leg because of COVID and the additional funding. But no, we have a pretty good track record of meeting it, so.
Great. We'll move on to item 11.
Oh, wait, and this is where I can
yeah.
say that I want to get the bylaws on a future agenda.
What about the bylaws?
Well, I don't want to discuss, that would be discussing them, so, I mean, can't really discuss them, right?
I mean, I guess I would need to know specifically what you're looking for, just so we could be prepared.
A review and an update of them. And for my information, I'd like to know when the last time. Specifically, when I reviewed them before, I noted that there were certain requirements of individuals, experience requirements on the commission, but there's no requirement that anybody have a nonprofit background. And so I suspect the bylaws were probably last approved maybe before aid agencies became a function of this group. And I think that there should be a requirement on HCDC for somebody to have a background in nonprofit management administration.
For them to be a member?
No, have experience. prior experience, so.
In order to be a member.
Yes, just
to be a commissioner, the way that,
Yeah.
say, like the airport commission requires you to have certain relevant experience, I think you're proposing that relevant experience for HCDC would be nonprofit management.
At least one member. I'm not saying all, so there is currently, I think, somebody who has some experience in housing, or that might be you. So they're looking for some commissions have gender requirement. In fact, this one might have a gender requirement
They all
too.
do.
So I'm just asking that there be at least one person with nonprofit experience included. That's my suspicion. That's why I'd like to know when's the last time that they were reviewed.
I can look into that in the process to amend the bylaws. When we looked at this once before for including Robert's rules, I have a vague memory of, I think we need to discuss it at multiple meetings, and I think it has to go to council.
Yeah,
So
I think
it's
I think it's 2 votes and then something else. It's been a little while since I've looked at the bylaws. I didn't think any of we had any experience requirements for any of the slots.
Yeah, there are.
There are experience, I don't know if you call them requirements. If they can't fill the spots, then they'll resort to filling it with an applicant who maybe doesn't tick those boxes.
Isn't there a requirement that one member be utilizing a housing choice voucher or?
Ideally, yes, but sometimes if they can't find applicants that meet those criteria, they'll fill it with someone who's willing.
Well, I will just out myself here. I am a recipient of the voucher program, so I meet that requirement. I also meet the requirement for nonprofit administration experience. My entire career was spent in executive management and nonprofits here in the state of Iowa. And so I understand grant processes and all that sort of stuff. So probably when my application came in, they were happy to see it, I guess, maybe.
I listened to the discussion, and I actually appreciate having your background and experience, both in being a user of services and the experience. What I'm saying is, it seemed to me when I read them, if I see requirements in like housing or whatever, that a good chunk of our time is taken on reviewing grants and, reviewing a program. How do we manage a program of legacy agencies and such? And if you have, I think it's better for you to have somebody in nonprofit management experience, to be perfectly honest. Not currently, have some sort of experience in that. I'm not, carving what that experience is out, but I just think it should be important enough to be in the bylaws as far as I'm concerned.
So I think the item you're looking to add would be a bylaws discussion focused on experience, relevant experience for status as a commissioner.
Yeah. Well, and, again, and this is just probably me, but when we were asked to review the housing voucher program to find out that that whole process hadn't been reviewed in 20 years, I just think it's a good idea for us to take a look at those governing documents and say, does this need to change at all? So it should be reviewed on a regular basis, whether that's every 5 years or as a special need comes up. That's just me. So I'll just be happy to get it on a future agenda item and discuss it.
That sounds reasonable to me. Did we have any other discussion?
Nope. Nothing for me.
So do we have a motion for adjournment?
So moved.
Second.
And all in favor?
Aye.
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 Aye.